Thank you for a very kind words. We are here. We all know our motto and mission: Cervical Cancer Mukt Bharat. And we also know that a gynecologist till now have a very stepmotherly behavior as far as cervical cancer prevention was concerned. And that's why they never skilled themselves. It's a very harsh fact, but that's a reality. So it's a high time the Indian doctors focused on a public awareness on cervical cancer prevention. This is a presentation which we have made. Is for all of you who are going for a public awareness program. You can utilize the same. You can see the cervical cancer is the leading cause of mortality among women across globe. In 2020, a little more than 6 lakhs cases are there of cervical cancer, and out of that 3.5 lakhs patients die. This is a global figure. As for the 26 countries are concerned, this is the commonest cause of cancer. And in 36 countries, just like India, it's a major cause of death of a woman. As you can see this Airbus crashing, 200 female passengers die every day in India because of cervical cancer. Yes, 200 people. There is no cabinet meeting. There is no newspaper coverage. And what we can find, the similar kind, every 1 in 8 minutes, one woman is dying. Every 8 minutes, one woman is dying. WHO director thought about looking at Australia and the trend of cervical cancer decline in the Western world. So he's very sure this Western world is probably in the next decade will be cervical cancer free. You all know the reasons? That cervical cancer screening was started in 1940. Pap smear came in 2024, in 1924, and soon after they started a program. So many years have passed. And I know, अंग्रेज जब कोई काम करते ना, तो seriously करते, very meticulously, because the survival of people who are employed in that particular program depends upon their efficacy. So the WHO director thought this can be duplicated in the lower income group as well as in middle income group. And they came with an idea of 90%, because these countries say that we don't have any resources for women. So okay, don't vaccinate everybody. You will just vaccinate less than 50. And they also set the target for gynecologists that 70% must be screened. They cannot imagine that a country like ours have 3% screening rate. And 90% patients need to be treated for precancerous lesion for it to be zero breakthrough as far as the cervical cancer is concerned. These slides are for public awareness. We all know that the cervical cancer, I remember days about 12-13 years back, even a journalist girl, if you ask that this is a cervical cancer vaccination, she will ask me, what is cervix? Doctor Sahab, neck ki baat kar rahe ho? Cervical pain ki? Yes, I would like to have a vaccination. So that was the knowledge, and that knowledge has not increased because we don't make our girls aware about their own physical parts. But we all know it's a sexually transmitted disease. And when the cervix get infected with HPV, you find there is a time, जैसे गेस्ट को बुलाते हैं घर में, थोड़ी देर में आके वो चले जाते हैं, पर कुछ गेस्ट ढीठ होते हैं, बैठ ही जाते हैं घर में. So when they become persist in the cervical epithelium, all that grades of cervical intraepithelial neoplasia start, and finally it leads to florid cancer, which is 100% preventable and should not happen. The question comes, who all are at risk? Nearly everyone gets contracted with HPV at some point in their lives. Over 51 crores women aged 15 years plus are at risk of developing cervical cancer. It's the second leading cause of female cancer in this country, and the second most female cancer in women aged 15 to 40 years it is seen. You'll be surprised to know that deaths due to cervical cancer are 3 times more than the maternal deaths. I again repeat that cervical cancer deaths are 3 times more than the maternal deaths. And that brings us, what is the maternal deaths per yearly? It is 25,000. As for the signs and symptoms are concerned, you all know at an early stage there is no sign and symptoms, but when it's advanced stage, patient can have a postcoital bleeding, intermenstrual bleeding, and bleeding at the time of examination. Now, whenever these kind of symptoms are there in the public, they should be made aware about it, that they should not sit back at home and they must consult their doctor. Public has it in their mind now, HPV means cervical cancer, but it has a very wide spectrum. You all know that is vaginal cancer, vulval cancer, anal cancer, and oropharyngeal cancers. And oropharyngeal cancer increase is seen now because of the increased prevalence of oral sex amongst the youngsters. Now, as for the HPV, it also causes genital warts, the low-grade lesions. So, apart from causing cancer, HPV can cause warts at the genital sites, and they appear as brown and pink swellings. Sometimes they take a cauliflower growth, and these warts are non-cancerous. We thought it would be non-cancerous. This was promoted as non-cancerous. But the Denmark study of 50,000 people has shown that these very patients who had genital warts in past have increased incidence of HPV-related cancers. They cause itching and discomfort and the bleeding after intercourse. You can see the males are equally affected. The cancers in them are anal cancers, penile cancers, and oropharyngeal cancers. They also have warts. This is the kind of, when you picture, you show it to them, then both ladies and gentlemen realize that they have these kind of warts. Mode of transmission, it is sexual transmission mainly, and it is during the vaginal, penile, anal, and the oral sex. Poor genital hygiene is also partly related to it. Males act as HPV reservoir and transmit to the female partner, and skin-to-skin contact during intimate sexual relationship is also equally important. Now, as for the challenges of cervical cancer in the community is concerned, the cervical cancer affects a woman in the prime of their lives, when the woman is most needed in the family. And that's a time for the family to have economic stability and the social stability as such. Now, it enforces the victim to reduce their work productivity while they incur heavy medical cost in the treatment. Now, challenges are associated with cervical cancer as a woman is concerned. There's a social discrimination. The moment you say that so-and-so has cervical cancer, TB की तरह तो नहीं, but थोड़ा उससे closeness है as far as discrimination is concerned. Loss of sexual functioning, loss of femininity, or womanhood due to infertility problems, and the loss of confidence as far as this woman is concerned. The other challenges are the financial distress, work and employment challenge, and invariably she has to sit back at home, and the loss of monthly income is there for the family. So, public has to think about it, that prevention ki sochni hai. And now we have with us 90, 70, 90. If we do this alone, in 2030, our mortality will be down by 1/3. If we are at the various figures given by the Government of India for cervical cancers are varies between 60 to 75. So 1/3 it will come down by 2030, provided it is 90, 70, 90. Now, when we are talking of prevention, it doesn't register. We all own cars, they go for servicing, it incurs very small money, but in case if you don't do this, major cost can be there when there is a major breakthrough, and the similar kind is there with cervical cancer. Prevention में तो थोड़े से पैसे लगते हैं, but when it comes to cancer, it is colossal amount. So what we need to do? We need to create public awareness. And where we can go? The school, the colleges. We can make teachers aware about it. We can make parents aware about it. And we also can talk about prevention to them. In schools, the focus is on vaccination. And the message must go to them that every child must be given vaccination prior to she get exposed to the sex. We can also go to the organization where they have large number of people. They can talk about the employees' family welfare. And again, there's a lot to do at that particular stage. Now you can understand what is your role in school, colleges and organization. Create awareness, conduct vaccination campaign, and guide the parents. So, no need of cure or talking about cure of a cancer if you can prevent it. So, care right away. The HPV vaccination could prevent cervical cancer and other cancer caused by certain types of HPV that also I have just now told you. Now, this is the pyramid of cervical cancer prevention. The vaccination is a broad bottom. The gynecologist must see this particular bottom, because this they have been neglecting so far. 0.1% is the vaccination rate, and out of that 75% the pediatricians are credited. So you can see what is your role. When it comes to awareness, public awareness, they need to be told that now we have our indigenous vaccine, robust vaccine, just like COVID vaccine. It will have similar kind of laurels as the COVID vaccine got it. And this is a gender neutral vaccine. 9 to 14 years, 2 doses, and after 14 years, it has to be 3 doses. Now, the upper limit, which they have got permission from the Drug Control of India, is 26 years. So, the message is very clear. The prevention of cervical cancer is much better than treating it, and this particular vaccination per dose is 2,000 rupees. We all know that we have 3 vaccines are available in this country. 2 are Gardasil 4 and Gardasil 9, and the remaining one is Cervavac. Cervavac is not going to be rolled out again in the Indian market. So for us, it is almost closed chapter. Now, as for the secondary prevention is concerned, all of you know about it, that the screening is very important. What is the global screening criteria is you start at 21, stop at 65. The revised one of WHO considering the low income group and the middle income group is that you start at 30, finish at 50. For HIV patient, it is 5 years earlier. So for them it is 25 and upper limit remains 60 for them. Now as far as WHO is concerned, they wanted screening by the most reliable method, and that is HPV. 15 oncogenic virus should be picked up. That is their recommendation. We all know that we do not have an antigen test for these 15 viruses. Thyrocare has brought a kit which is again imported. And as far as Modi's government is concerned, nothing will be imported. It has to be indigenously made. So things of that particular kind are out. So we all know about till 30 years pap smear or LBS, and after 30 years it is pap smear or co-test. But I think, that particular, these two things are, we all know it is 3%. You have to do introspection, what have you been doing? But if you want to touch this 70%, it is nothing short of VIA and Willy. VIA is 1 rupee test. If you combine with Willy, it becomes 5 rupee test. The government has spent 4 crores of rupee in training you as specialist. So it becomes your duty कि हनुमान जी के मंदिर में चढ़ाने से अच्छा है कि आप कुछ लोगों को स्क्रीन करो, तो हनुमान जी खुश हो जाएंगे instead of giving that kind of चढ़ावा to the mandir. So this is the information which you pass on in public awareness, and if they have problems, they have to consult each doctor. This presentation is already put on the, Malti has put it on slide share, and she will share the link with each one of you, which you can liberally use this presentation.